Turn the mic on. Okay. All right. Good morning, everybody. Sorry we're a couple minutes late. My fault. Today, Tuesday the 20th, this is the staff meeting for today, and so I'll turn it over to the county manager, Tom Stoltz.
Thank you, Chairman. Good morning, Commissioners. We have two items for staff this morning. One is a COVID update that was requested by Commissioner Lopez last week, and with what we saw yesterday with the hospital numbers and some of the way that the numbers are moving, I think it is very appropriate to talk about that today. So Tim Kaufman is here, and we'll present on that first. And then the longer topic is Lindsay is going to begin discussions regarding ARPA dollars, and it's crowded today because we have a lot of public safety partners in here, and we're going to be talking about public safety use of ARPA money, and Lindsay will lead that discussion. So Tim, if you would start us off on COVID, wherever you're at.
Morning, Tim.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager, here to do a COVID update. And we checked, and this is the first time in about 60 days since we've done one. So there have been a number of changes. Some things still sadly remain the same. But from a vaccination perspective done by the health department, you know, in prior times we were talking about thousands of vaccines that were being dispensed by the health department each week. Last week we did 560. Which is a much, it's slowed down quite a bit, and that's unfortunate because the disease is still out there. So we have delivered a total of 230,657 doses. Included in that number is 113,721 second doses or the single dose Johnson & Johnson. So those folks are considered fully vaccinated. So that's the health department vaccines. From a community perspective, here's how many folks have been vaccinated in the community. As far as we know, again, there's a few people that have been vaccinated that don't report in the traditional way, so we don't have all of that. But this is a pretty good snapshot of the number of folks that have been vaccinated. And so we've got 187,608 individuals that should be considered fully vaccinated, either that second dose or the one dose Johnson & Johnson vaccine, and cumulatively, first and second doses, 392,000 doses. So that's a lot of work by a lot of healthcare providers to vaccinate folks. But again, that fully vaccinated number is certainly much lower than we wish that it was right now, and we continue to modify our efforts to try and make sure that we can continue to increase that number. That number of vaccines gets us to a vaccinated rate of 43.5% of the folks that are eligible for vaccine right now. Again, vaccine's only available for those 12 and older, and so right now we're at 43.5% of that roughly 390,000 folks that would be eligible to be vaccinated. We are now vaccinating anyone ages 12 and older. I saw something yesterday that indicated that a vaccine for the ages 6 to 12 potentially may not be available until midwinter, so it's going to be a while before that's available. We have significantly increased the number of mobile and partner and event-based vaccinations. We've talked a number of times about what mobile and partner clinics are. Event-based vaccination clinics now are where we go to where we know there's going to be a gathering of people, and we're going to try and just pick up people because they're there. Again, we're trying to make things more convenient. A good example is, I think 2 Fridays ago, we were at the Wind Surge game, and so as people were coming into the Wind Surge game, we were offering vaccinations, and our partners with the Wind Surge were then offering some tickets for future games. And so we're trying to find other events where there are going to be large gatherings of people that may not have been vaccinated, trying to make things as convenient as possible. We're taking the vaccine to them. Our community clinic at 223 South Main no longer requires an appointment. It's fully walk-in. We're available Wednesday through Saturday. Wednesday, Thursday, Friday, we're there 11 to 6. Saturday, we're there from 11 to 4. So we've got weekend hours, we've got evening hours, and then again, as I said, we're spending a lot of time on Monday, Tuesday out in the community doing mobile clinics and partner clinics. And all of those are available on the Sedgwick County website. If you click on the banner, it takes you to the vaccine page, and we've got all the information about all the vaccine options available. Because of demand, we have ended the drive-through clinic at 777 East Waterman. We now are working with anybody who has mobility issues at our 223 North Main clinic. And so if someone has difficulties navigating mobility-wise, if they'll call 660-1022, we'll work with them to get that vaccine for them. Generally what happens is they pull up, they call inside, and then we send somebody out to their car to vaccinate them. Individuals that are homebound can contact the Aging and Disability Resource Center that our Department on Aging manages is 855-200-2372 for assistance accessing the vaccine. They have been working with lots of different community providers, people who serve homebound individuals, getting their information, and then working with one of the local home health agencies to go into the home to make sure that we're able to vaccinate individuals that can't get out to one of our mobile clinics or to the fixed site clinic. Some of the things that we're looking toward the future on, particularly variants, and the Delta variant has been in the news quite a bit lately. It looks like somewhere between 40 and 60% of the current infections are tied to the Delta vaccine. When positive test results come back, those go to the KDHE lab and they type them to see what type of a variant it is. If there's enough viral load within the sample, not all samples are going to be typed by variant, but now it appears that about 60% of the current positive cases are tied to that Delta variant. Dr. Norman late last week said that we're in an outbreak right now because of the Delta variant. The Delta variant itself is an outbreak across the state. In the Midwest, about 80% of the positive cases are now tied to that Delta variant. And there are questions about the Delta variant and how it impacts young people. And in reality, the Delta variant impacts young people because young people haven't been vaccinated or they don't take the precautions that they need. And so it doesn't really target young people any more than anyone else, but we know from our vaccination data, young people aren't getting vaccinated. And this is another reason why it's really important for people to get vaccinated. Those variants are coming. The Delta variant is somewhere between 40 and 60% more infectious than previous variants, and so it just spreads things quicker, particularly among unvaccinated folks. It's just going to continue to spread and infect folks, and so that's why I encourage people to get vaccinated. And one of the things that we're starting to see nationally is that people that maybe got their first dose and decided that that was enough, or they didn't have a positive experience, they were sick for a day or two, decided not to get that second dose. The Delta variant is a really good reason to pick up that second dose. Even if it's been a month or 2 or 3 since you got that first dose, still go get that second dose, because what we've seen nationally is that the vaccines that we have are at least 88% effective against the Delta variant, and so that's really still very good effectiveness. And so we'd encourage people to get that second dose if they haven't yet, and to come in and get their first dose. And again, we're trying to make it available in lots of different places across the community. The other thing that we're concerned about, again, is the impact of the Delta variant and others on the positivity rate. We're now back at 6%, which is the highest it's been since very early in May. And the number of cases per week, positive cases per week, again, about as high as it was in early May. It had dropped quite a bit, and now it's increasing again. So we want to make sure that people continue to get tested. We've got testing available still 5 days a week, and we've got our vaccine clinic. We've got just about any day of the week you can get a vaccine if you want to go get one. And then schools are reopening, and we know that a lot of the kids that go to school are under the age of 12, and so that is a concern for us. We're going to continue to monitor it and hope that anybody that is working in schools gets themselves vaccinated so that they are not putting those kids at risk as well. And again, if you're homebound, we want people to call the ADRC, and they'll help them get vaccinated. And again, our website has all the information regarding locations that will be, information about the vaccine, and I'd be happy to answer any questions you may have.
Okay, Tim, thanks for the update. Yeah, the hospital numbers yesterday were almost double from the week before. That was a little bit alarming news, but it is what it is, I guess, on that. So thanks for, yeah, they went to 72 patients, something like that now, versus 38 the week before. So.
The dashboard, Jack was out of the office yesterday, so the dashboard was just updated today, so
Right.
that'll give comparative analysis.
And again, the best thing you can do to keep yourself out of the hospital is get vaccinated.
Well, I saw that too, yeah. The vast majority, if not every one of them, are not vaccinated. Okay, Commissioner Lopez.
Thank you. Well, I just appreciate you coming today, and you answered all of my questions because I sent this to you before, but I just want to thank you for coming and giving us an update so the community can just kind of hear that our positivity rate and everything is rising and that we need to start really trying to bring that back down. So, thank you.
Okay, Commissioner Cruz.
Thank you. Do we have any stories of people who were like vaccine averse that got sick and then got a vaccine? Do we have any stories about, that we can share that would possibly change the tune of those who think the vaccine is going to do whatever it's going to do to them?
We do, and I'll work with communications to get some of those stories out there. But we have been asking people, as we contracted the number of days that we were vaccinating and that sort of thing, we started asking people, why'd you come in today and why'd you come in to get vaccinated? And most frequently, the answer is, well, my family members convinced me to. Usually it's a wife telling a husband to get vaccinated, but it's family members applying pressure and encourage their loved ones to get vaccinated. And for others, it's because there are things that they want to do, or they want to go, when school comes around, they don't want to have to worry about wearing a mask, that sort of thing. Or they're seeing in the news this Delta variant is much more pervasive, and so they're a little concerned about it. But we'll get some stories, and we'll work with communications to get some of those out there as well.
Yeah, it just, I have a friend I went to high school with, and her 15-year-old daughter is battling brain cancer. And they've been doing everything that they can, and now she has COVID. And so it's heart-wrenching that we can do something so simple to save those most vulnerable, and people, for whatever reason, don't take that precaution. And I just wonder how we can touch people so that they feel the need to go do this. It could save someone's life. It could save this 15-year-old girl's life who is already battling a brain tumor. And that's just one story. I'm sure that there are others out there that people could share. And I'd like to see our communications department or some at the health department find those stories and at least try to reach people that are unreachable currently.
We'll do some more of that.
Thank you.
Okay, any other comments? I don't see any, so thanks again, Tim, for the
Thank
update. Okay, next item.
Okay, Lindsay?
Well, good morning, Commissioners.
Good morning, Lindsay.
We have a full room today, so I'm going to try and get through some of the intro material quickly. So you should each have a packet that looks like this at your seat. It was emailed to you Friday evening. There is only one update from the version that you received on Friday, and that is a new line 17 for the Regional Forensic Science Center on page 2. So the front page tells you basically where we stand with the American Rescue Plan Act. It was approved back in March. We know that through a specific bucket called the Coronavirus State and Local Fiscal Recovery Fund, we received just over $100 million total in allocation. Of that, $50 million, and the specific number is listed there at the top, has actually been deposited in our bank account as of June 1st. We expect to get the second equal allocation the same time next year. You can see on that front page the allowable uses. It looks very much like the coronavirus relief fund, so the CARES funding that we had, response to COVID, premium pay, the cost of government services to the extent we had revenue reduction, and investments in water, sewer, and broadband. Now, guidance was issued, an interim final rule was issued on May 10th. What that means is, because it's interim, it's not actually final, even though the word final is in the title.
It's kind of an oxymoron.
It is, just a little bit. So we had to turn in comments and answer questions that were spread throughout that document as of July 16th. And Treasury has said that they expect to return final guidance to us within 30 days. And so we expect that by mid-August, we will have a better understanding of how we can use these funds and how we cannot, with a little more specificity. Now, you can see they've already issued a number of frequently asked question materials, and that is actually a large part of what's driving us to the discussion today. So even though we don't have final guidance, we know that there are some urgent things that we want to plan to fund. When we came to you earlier this year with a strategy for 2021, it was to use the CARES personnel dollars that had been placed in the general fund last year, and we had an estimate of about $15 million through the first 6 months. We have gone through that, and as you'll see when we get into this, we still expect excuse me, some pretty significant costs between now and the end of the year. We also know that through some of the recent FAQs, the courts, the backlog, public safety, crime, are basically presumptive okay uses of ARPA. And so what you will see on page 2 is a list of what we consider to be urgent needs related to how we can use our ARPA funds, recognizing that we don't have final guidance. So we are doing things here that we are confident are very clearly okay under the rules. So you can see at the top the dollars that are associated with the public health response. So continued temporary positions and testing and vaccines for the health department, some logistical support for EMS and emergency management, fit test to make sure that our first responders have a position that can go out and make sure those fit appropriately, the communications, making sure that there's still COVID testing in our congregate settings, then the basic things that we've been doing that you've heard me harp on every week last year and every month this year about PPE and cleaning supplies and those kinds of things. But then there are 2 programs that are really focused on outside type functions. You'll see community navigators, which we'll talk a little bit more about tomorrow during the spending plan presentation during your commission meeting. And then what today is focused on, which is court backlog and public safety. And we happen to have all of the experts in the room, who I am so grateful to, have come together over the last 3 weeks to put together all of this information so that we can figure out a strategy to try and address the extensive court backlog. You'll see that premium pay is listed as a simple dollar allocation for now. We don't necessarily have a strategy for now because we want to make sure that commissioners are okay and give us some guardrails there, which we'll talk about tomorrow. And then, of course, ARPA management and remote work are listed there. So what I would like to do is focus on everything after page 2 for this discussion. And you will see that this information is ordered in the same order that I'm going to ask our presenters to come up and tell you more about what their needs are related to the court backlog and public safety issues that we're experiencing. So we're going to ask Mr. Bennett, the DA, to come up first. Then we'll go to Judge Gehring to talk about the courts. Then we'll go to Sheriff Easter. Then we'll go to Glenda Martins, and then finally we'll wrap up with Dr. Steadman. So I will ask Mr. Bennett. Oh, he's already here.
Lindsay, also, we're going to get these presentations. So from your page 2, for instance, the district attorney will be here, and that number will come up to the 365, 722 on page 2.
So on page 2, this is what it takes to get us through 2021. I'm actually glad you mentioned that.
Okay.
Process-wise, we will come back to you at the end of 2021 with a strategy for 2022 through 2024 after we have an opportunity to understand what all needs are out there and what the guidance really says we can do. So what you will see listed throughout this information is their need, the annual cost impact, but for now, we're focused just on what it takes to get us through 2021.
Okay. Yeah, and Commissioner Cruz, sorry, I didn't see your line.
So, line 12 of page 2 is obviously the tab for the court backlog, but when you go to 14, it just says courts. So for clarification's sake, this looks like there's a lot of court stuff here. Can we figure out and determine like exactly what that means? I mean, you got remodel for courthouse space and then you got courts. I guess I want to know exactly what courts means.
So that's a great question. So in the packet on page 7, there's basically a cover page for every group that's going to get up and talk. And so the information that they have submitted, so for example, the district court is on page 7. Their information explaining their need is the next few pages.
That's number 14?
Well, and that doesn't refer to a page number per se. Is that what you're asking?
Well, I guess I'm wondering, number 14 on page number 2, we're gonna spend, you're proposing $1.6 million to go to courts. So, but a lot of this is courts. So how is it broken down for more clarification's sake to understand? Like, is that gonna start on page 7?
So the court backlog and public safety on page 2, that's kind of the general header. Then everything under that is related to that under the gray section. So then, like the DA is listed first under the gray row 12. Mm-hmm. So that corresponds to this DA section that comes. Then courts needs are listed separately, like the actual district courts needs are listed separately, and their data is listed separately. And on page 11, you'll see numbers. Then sheriff has additional needs. So if we flip over to page 12, that starts the sheriff's section, and so on and so forth. Now, the facilities part and the Regional Forensic Science Center part don't have their own pages, which is why there's just that brief description next to them to explain what it is instead of referring you to additional pages, if that makes sense. And I can...
We'll get to it, it's fine.
Okay, I'm sorry for the confusion.
All right, well, good morning.
Morning,
as
Mark.
Lindsay said, we've been meeting the district courts, the district attorney, sheriff's office, forensic science center, corrections, all the people, all the different agencies whose work is very much intertwined one with the other. So I can stand up here and start this conversation, but my needs and what I do is influenced by, and in turn influences also the courts, the sheriff, corrections, forensic science center, et cetera. So this is very much an intertwined effort here. To give you a sense of my things are set forth here on what I believe is page 5, the asks for my office. But to set the stage a little bit here, I'm going to give you a few points of fact. So I asked my staff to do a comparison between March of 2020, when this event started, when COVID first impacted Sedgwick County, and today's date. And what you'll see, and actually I got this from Ellen from the courts, the overall numbers we've been managing this, trying very hard not to overwhelm the courts and the court system, because if we do, the court's ability to process cases effectively and efficiently is significantly impacted. And if the courts are impacted, then the sheriff's ability to staff those courtrooms is impacted, which has a cascading effect on his operations, which then Glenda's operations with corrections is then impacted as well. So we have held back filing cases. So for instance, we have 434 cases that have been approved for filing. That number was significantly higher last year, and we have done all sorts of things I've talked to you about in other ways, and we're going to go through it all again today. But over the last year and a half, we have not just kept them on a pile, but we tried to work that pile down. We're still at 434 cases that are ready to be filed and entered into the system. They're lower level, nonviolent crimes. The obvious impact on community safety is less, and so we have tried to, rather than overwhelm the system, hold back, filing a few each week as that as we process through the existing cases on file. We've got another 280 cases that are being reviewed right now, and then in the normal course of business, we'll continue to charge cases. But we do not turn away cases that are viable for charging, that we've determined are chargeable, provable cases that are of violent nature, that have an immediate impact on community safety. Those have to go to the front of the line. And so what you've seen in Ellen's numbers is, while the overall numbers of cases has been about static, I didn't add it all up, but what you'll see is, I'll get a little technical here, but off-grid offenses. So off-grids, what we refer to as homicide, first-degree murder, and Jessica's Law cases and capital cases. Those are the only three categories of cases. There is an 80% increase from March of 2020 to March of 2021 in those types of cases. A 90% increase in severity level 1 offenses. That's aggravated kidnapping, aggravated criminal sodomy, rape, second-degree murder, that sort of thing. 25% increase in level 2s, 50% increase in level 3s, 57% increase in level 4s. Now, you get down into the low-level nonviolent crimes, we've had a reduction because we've not put those cases into the system. So I don't want to give you the impression that we're just blindly throwing things into the mix and making it worse for ourselves. We are trying to manage this, and it's a fine balance between managing our caseloads and risking public safety. So it's an ongoing effort. But I think that speaks to, I mean, if we're going to talk about this in terms of two parameters that you need to assess this money and how it's spent, it's public safety, as I understand it. Those are the rubrics by which you all are to gauge where money goes. Public safety and backlog. And so I wanted to give you those numbers because the backlog is there, not just in terms of some massive number, but the backlog is there specifically in terms of the most violent crimes, most serious crimes. 240 off-grid offenses. And that's 240 either murders or the equivalent of murder. And each one of those is a tremendous undertaking for an attorney or a staff, or a group of attorneys to try. We typically assign 2 people to those cases because they are so burdensome. 179 level 1s, 216 level 4s, 185 level 3s. These are major cases, and there's a tremendous backlog, a tremendous glut of those that we had to work down. So that's the very quick overview of what we're up against and why it impacts, why I think what we're asking for here is speaks to public safety and speaks to the pandemic-based or pandemic-induced backlog. I also want to say, too, I think, and I don't speak for everybody here, but I know from my perspective, and I suspect that the sheriff and Shelley and Glenda would all say the same thing, the courts as well, Judge Gehring. If it wasn't for ARPA money, we wouldn't be here, obviously, asking for this. We'd simply get the job done. But there is a human impact on this for the people who work in our respective agencies. There's a human impact on the victims of crime. There's a human impact on the courts and the staff that staffs those courts, the jurors who have to come into court. And so this ARPA money, I don't want to seem greedy and just raise my hand. I want some of that, but it's there, and if it's going to be utilized effectively, I think you need the most information possible so you can make intelligent decisions about what to do with this money. So from the perspective of the district attorney's office, we have several requests that we think would help us and address these two issues, the backlog as well as enhancing public safety. So turning your attention then to, and this latest handout would be,
Mark,
again, page 5.
Can I interrupt you
Sure.
real quick, Commissioner Cruz?
Sure.
Hey,
Yeah.
Mark, while we're on this page 8, I do see that there is obviously a pullout for the drug charge and then felony drug and misdemeanors. But of all the other severity levels, what percentage do you think has at least one drug charge? Is that something that you could get me later? If you
I
don't
could.
mind?
I can tell you, prior to the pandemic, you've heard me say this. We went from, I want to say 13 to 16, 17, 18%. This is off the cuff, so I may be off a little bit. But we were in the neighborhood of about 20%. About 1/5 of our cases had some some count of meth specifically. You've heard that discussion. That number will be lower in 2021 because there will necessarily be certain cases that were meth only or cocaine only. And by pulling those out, because if I'm making choices, I'm going to go with the child sex case first. So necessarily, that will have an impact on the overall number of cases. But if I filed those 434, that's not on your list here, that's just my stats. I know I have 434 cases ready to file. I have an attorney who says, this passes muster, it should be filed. I just haven't dumped them into the system yet. I think we'll get back to pre-pandemic numbers. I say that based on experience more than having gone through each line by line. But there's no reason for me to believe that somehow methamphetamine use or cocaine use or anything else has suddenly gone down during the pandemic. I expect it would be at least as high as it was in before March of 2020, if not higher.
Okay, thanks.
Yep. So page 5 is where the specific asks are located in the grouping or the handout that Lindsay provided. 6 separate categories. I'll go through them each briefly and answer any questions you might have. The first one, preliminary hearing docket. This is, again, right off the bat, a very quick example of how my asks are intertwined with the requests of others here today. So the courts, have an approach here to help work down the pandemic backlog. Not to get too wonkish here, but when a criminal case is filed, the first thing is you have a first appearance, but then right after that you have a right to a preliminary hearing. And after the preliminary hearing, then there's motions and there's a jury trial. The backlog has been the jury trial. We have, because we did not close down the way many courts around the country did and around the state, we kept working last year in 2020. What Ellen told me, 15,000 hearings were held in 2020. 1,900 cases were resolved by plea negotiations. And so luckily for us, we are in a position where we continue to get work done. We continue to have prelims and have motions, et cetera. So the one thing we could not do was jury trials. So that's good. But we still have cases that need to have a preliminary hearing. And for the judge, I've got to juggle 2 things. I need to do a jury trial, but I also have cases assigned to me as a judge that I need to have a preliminary hearing. And so to free judges up to simply focus on jury trials, the courts have a plan, which I think is great, to hire retired judges to come in and just do preliminary hearings. That allows us to just do the prelims here so our 10 criminal judges can focus on jury trials. That will be the fastest way to work down that backlog. But to do that, there needs to be some infrastructure. We need to have a courtroom. We need to have a place for those retired judges to hear these hearings. And I'm asking for one staff attorney to help focus on just those preliminary hearings, that particular docket. So that's my number 1 FTE there, when it says staff attorney 3. Pardon me. That's what it goes to. And then a docket assistant, someone, a support staff member to help in that endeavor. Let's see here. Second, excuse me, I didn't read close enough here. Also, then there's a senior attorney and administrative assistant there as well. We're trying to give our best guess here. I think the preliminary hearing docket's going to require folks with a little bit more experience, because these are heavy hearings. I mean, we're talking about everything from rapes and murders to on down to the lower level crimes. So a total of 4 FTEs to address that preliminary hearing docket. But again, in the context of, I think it hits. My personal opinion is it hits both categories. It's a public safety issue because it allows us to continue to bring cases into the system. Number one, and on the other hand, it's also obviously a function of working down the backlog. Second major category here says discovery. So anytime a case is brought in, we have to provide all the discovery to individuals, meaning police reports, photos, surveillance camera tapes, et cetera. That has gone from a one-person position years ago, and frankly, when I started in the DA's office 24 years ago, a lot of times on the bigger cases, we did our own discovery. I remember standing there was a 5-defendant murder case that I prosecuted in '98, and I stood with my colleague Barry Disney, and we had a stack of discovery about that tall, and he and I stood at the Xerox copy machine and made 5 copies that tall for each of the 5 defense attorneys, just so we would make sure discovery was done. Today, no one no two attorneys could stand at a Xerox copy machine and deal with everything that's coming at us. Axons, surveillance cameras, every house in the city's got a Nest, doorbell cam, all of that sort of stuff. So we have a large staff who handles that, and with each of these cases, working on the backlog, we're going to need more help in that regard. I will say one other thing that has really impacted us. We have a lot of defendants whose attorneys, my staff has got tons of cases. You've heard me talk about that. So does the defense bar. They've got tons of cases, and they've got clients sitting in the jail or clients in the community who are out on bond who want, they expect a lot of time with their attorney. They're not, it's tough for those folks to get them as much time as they need. So we've had defendants who want to go pro se, meaning represent themselves, and when that is granted, I still have to provide discovery to them. But then I have to go back and remove things like Social Security numbers and bank account numbers and things like that. That takes a tremendous amount of time from our discovery folks to do that. So again, it's related to the backlog. And I'm kind of moving fast here because I'm mindful of your time and the other speakers, but that's another issue why we need that discovery position. Trial technology, I already talked to you about this. That was actually my one request in just the formal budget process. I need people to help my attorneys get everything ready, go in and edit documents. Pardon me, a judge says that you can use the interview of the individual, but there's one thing he mentioned, his prior criminal history in there. That's not to come in, so please, DA, go in and edit that 4 minutes out of the interview. I need folks that can help me with that, and so that's that trial technology specialist. We're paying for that right now, by the way, with salary savings, but I think the idea is that we would use this ARPA money for that. Clemency expungements, it just says clemency, but I'll say pardons, clemencies, and expungements. Pardons and clemencies are really the reason for this position here. In a normal year, throughout the course of my career, we get a month requests for clemency and pardons from the governor. We were supposed to respond, et cetera. During the pandemic, the number has just skyrocketed because there are people in custody in the DOC who don't want to be there because they're concerned about the risk from COVID, and so the ACLU and others have, just doing their job, have made dozens more requests each week than we're used to, and so it's tough to keep up. And having a paralegal who could help us in that regard would be significant, and that is utterly and solely a function of the pandemic and that body of law that's coming out of that. Finally, trial attorneys. We put in 4 requests here. Again, it's just with trying to keep my case. You've heard me talk about the raises and the issues attendant with that issue. It was just caseloads. And here I am talking about adding more cases into the system. So the only way there's only 2 ways to handle it. Well, 3, and we've kind of done the third way, which is just delay. But the only other 2 ways is just don't file certain cases or get more help. And so that's where this request is coming from. So that's my request. That's the basis for it. There's obviously more material here, but I don't want to overstay my welcome. But again, I would just underscore one final time that there's really no way to parse out my request from what the courts are doing, what the court's request from what I'm doing. I mean, the decisions we make to file cases impact the judge, impact what the sheriff does, impact Linda, impact what Shelley's got. I will say, I did notice that Shelley's Forensic Science Center had an additional request for the ballistics folks. I can just tell you that would be a godsend for us. It's very difficult for us to not have someone over there. So we're all very much interdependent on one another to get our work done. And so I appreciate this time to be here. And again, I'll stand for any questions, either now or after you've heard from everyone else. I can do it at the end, either way.
Okay, Mark, thank you. You get a question, but just before that, so Lindsay, on page 5, so what we're talking about, this ARPA money for the DA's office at the very bottom right-hand corner. So the total request is for 21 is this 321,000 number, and then you roll it into 22, ends up being $1,052,000, basically. Give or take.
Basically, although if you look on the next page, you'll see there's some incidental expenses
Right.
as well, and so we would include those. But yes, the expectation is probably at least 2.5 years to get this resolved.
Right, okay, and that's probably a consistent theme as we go forward. Okay, Commissioner Dennis, thank you for letting me ask first.
Thank you, Mr. Chairman. Mark, thanks for being here and briefing. I look forward to the other briefings. I know they're all interrelated. I'm very thankful that we got the ARPA money because no matter what, we'd be spending this money one way or the other. So it's kind of a godsend. But I'm going to have a question for you and probably Judge Garing, the exact same question as it comes up. And one of the things that I've been interested in some time is a Veterans Court. And I don't know if you need something added to the DA's office. I know the Judge Garing is going to ask for something if we can move towards the Veterans Court, but I don't know what the DA's office would need for that.
And I'll defer to the judge here. When we've spoken about this, I think my understanding is, and if I'm wrong, judge can clarify, we have a drug court now. We have a judge who handles the drug court. I'll say this and I'll look at Jeff and he can nod in affirmative or negative in a moment, but rather than create a new Veterans Court with a separate judge, I believe the idea would be use the drug court judge who does that on Thursday, Friday, to do a Veterans Court earlier in the week. Something like that. All right. So it's more of a kind of back and forth, but the idea is if he does that, then I think we could at least work on the same infrastructure that's used to support drug court. Nothing's just simply, I mean, those people who are working in drug court Thursday and Friday have other tasks Monday, Tuesday, Wednesday. So I'd have to figure out what to do with them, but we could accommodate it. But once I've heard the whole thing here, it may be that, maybe one more support staff member to help support that effort. If I do get the other 4 lawyers, that would give me, 4 lawyers in addition to the prelim lawyers. That would give me, I think, the infrastructure necessary to cover that, if that is something that's going to be expanded in the next year and a half.
Okay, so this total of $1,052,000 and so forth, and $321,000 in 21 and the other in 2022. You don't need additional funding or additional anything. I just want to make sure that we're putting all of the asks together at one time, and if there's something that we need to provide to get a Veterans Court moving, I think it needs to be included.
I would say, I'll hedge and just say this, if that is something that's going to be stood up in the next 6 months, I could come back to Lindsay and maybe ask for one, I'm not talking hundreds of thousands of dollars more, but maybe one more position, either a lawyer or a support staff to support that. Because we have a drug court now, I'm not standing it up out of whole cloth. It's not a brand new thing. I've got an infrastructure in place. Those folks are plenty busy, so I'd have to figure out how to get shift some work around. But I think we could get it done without a major additional expense.
Very good. And I'll ask the same question to Judge Garing here in a little bit, so he's prepared. Thank you.
But don't just ask me and the judge. You've got the sheriff who's going to have to staff it. You've got Glenda who's going to have, there's going to be an impact there as well. So,
very good. Yeah. Thank you, Mr. Chairman.
Okay. Commissioner Cruz.
So I see Glenda in the back saying it's going to be big. So I just want to ask another question. Thank you, Commissioner Dennis, for bringing that up. You kind of beat me to the punch. In addition to a veterans court, when we're talking specialty courts, when 30% of the people in our jail right now are suffering from a mental illness, when do we consider a mental health court? We have one across the street. How do we consider that here when those who are going through our system, have a diagnosed mental illness? I see in Johnson County, they have a veterans court, and even one person going through that is significant. So I'm not trying, and please be sure to understand exactly what I'm saying. I do think it's beneficial, but when we can see the numbers with a mental health issue here, when they are, Sheriff has been talking about this my whole time on the commission, those numbers are steady. We know exactly who they are. They can be identified. How are we going to work to stand that up? In addition to a veterans court. I mean, when we talk about specialty courts, we see success with our drug court. Could we see that same kind of success if we put our energy to a mental health court?
Yes, and I think, too, that I'm not sure there's as big a distinction between a veterans court and a mental health court as may seem on the surface. Mm-hmm. A veterans court is simply a mental health court for veterans, honestly. That's the PTSD and the things that impact them that may be related directly to military service, but it's a model based on a mental health court. And so, absolutely, it's just a matter of infrastructure. I mean, all of these things, it's tough for why doesn't the DA just stand one up? Well, as I started this meeting off, everything I do is dependent upon and impacts the courts, the sheriff, corrections. These courts, it's not like a normal court where, and maybe I'm saying this more for the public who may be watching than for you, because I know you know this, but it's not a court where two attorneys stand up. The prosecutor is on one side of the room, the defense attorney is with the client on the other, and there's a judge. We make arguments, the judge rules, and we're done. Maybe calling witnesses. A mental health court, a drug court, a veterans court is there's a whole lot more infrastructure in place in the courtroom. And it's heavier, frankly, on the corrections side, on the court services side, or whichever agency does it in a given jurisdiction. But it's the advocates, the support staff, the people who support these folks and get them to the treatment they need, make sure. And so it is a collective effort and requires a collective step forward to get those sort of things off the ground. I know, I'm all for it. I think we have to understand the commitment, because that's the thing that's held it back. The drug court, for instance, as successful as it is, has a large footprint fiscally. And so there's got to be a commitment on all of us to make that first step. So
Have we considered the numbers of what it would cost? I mean, we have the drug court numbers of what that costs each year. Have we ever run numbers around a veterans or mental health court?
I can say that when it's been discussed, the drug court as a model is sort of a baseline, but there's one additional thing, and that is the clinicians. That's a level of expertise required from either ComCare or some other facility. Would probably be ComCare, and frankly, the numbers at ComCare right now are down. So that's been the impediment to getting this off the ground. But I think you start with the drug court model, because that's all of that infrastructure's got to be there, and then you add to that the folks with the specific clinical expertise, additional education necessary to offer the treatment necessary for these folks to be successful.
Well, when we're talking millions of dollars, how can we implement programs that will really help folks and reduce recidivism rates? When we talk about the number of people in our jails, what is something that we can do that could be used with this money, understanding we'll have to sustain it in the future, but what could we do to start it now so that we don't have these big backlogs? I mean, how can we start slowly, incrementally moving the needle so that we can see better outcomes for the folks who go through our court system?
So I think there's a tandem response to that, and I don't get too far out over my skis, because what I say I don't want to commit others to. But for me, if we expanded from drug court to call it veterans court, call it mental health court, call it a mental health court where one afternoon is devoted to veterans, whatever. We have a judge who that's his or her week is specialty courts. I have an attorney then whose week is specialty courts. They're in court every day doing those things. From my perspective, that's a fairly straightforward ask. Not easy, but a straightforward ask. I'm going to defer to Glenda, because that is not a straightforward ask for her. That requires expertise. It requires caseloads, because I get done, my attorney comes back downstairs and reviews the next day's dockets. Her people have to go back and meet with those folks and sit down with them and figure out what it's going to take to make that person successful. That's a much heavier lift for her. But we could do that. The second part of that is, just as I was sitting down this morning, Linda leaned over, and we're working on, and I think have an MOU in place to give voice now to House Bill, I think it's 2026, I think it was, 2026. I mentioned this last time. It's the expanded diversion program that allows Senate bill money to go toward pre-conviction, diverted individuals for level 5 drug offenses. It may sound like I'm talking, well, that's drug. I'm talking about mental health. They're intertwined. There is very few people who are, mentally healthy, emotionally healthy people using methamphetamine. These are folks who could benefit from treatment, and I think that is something that's going to happen because of the newest legislation. So there are two tracks being moving forward at this time. last thing I'll say is this. I mean, we could keep talking about this, and I'm willing to do it. If you really want to have that conversation about mental health courts and what it would take to stand up, my guess is we need to have a separate conversation, maybe come up here in a week or two, give us a little time offline to figure out what that would really take. And I'm happy to be a part of it, because I agree with you. Anything we can do, 10% here, 11% there, 5% there, to reduce the numbers. I don't want to be here in 5 years. I don't want my successor to be here in 20 years and say, I need 50 more lawyers. Because it never ends. A bigger jail, a bigger DA's office is simply reflective of more problems in the street, and I want those to be reduced.
Thank you.
Yeah.
Commissioner Lopez.
Thank you. Now that I'm thinking about this, this might be a better question for the end, but I'll just go ahead and say it, and if you want to address it at the end, that's totally fine. But, so I'm looking at the DA, and so for the FTEs that are being asked for this year, it's $321,459, but next year that goes to, or in 22, it goes to over $1 million. So when we're looking at this, just overall for 21, it's going to, if everything that's asked for gets done, it's $37 million. What does that go up to? Because that's also at the courts and everywhere else that's asking for FTEs. I mean, realistically, what would this cost over the next few years? Because that seems like that would get pretty much all of our ARPA funds. So I'm just trying to understand that a little bit better.
Sorry, it is, I have those numbers in a spreadsheet. I will get them to you when we talk about the spending plan tomorrow. It is significant, but I would point out that of this 37 million, there are quite a few one-time costs. Premium pay would be a one-time cost that wouldn't be recurring. The $7 million, which we'll get to here at the end, related to remodeling this building into court space to accommodate all of these additional staff. That's a one-time cost. There's a contingency that's built in. Hopefully some of this health costs will taper off. So I will get you the total numbers for the courts, but of the 37 million, definitely not all of it will be recurring. And I'll try and pull that up here and have a quick answer for you here in just a moment too.
Thank you. And then I do see the public health response is listed at the top. I just, really quick while I have you up here, are we going to hear from our health department on the, when I talked to Tim and Adrian, they had a list of FTEs that they wanted as well. Is that going to come up here to discuss as well, like we're doing with public safety?
Because that looks so similar to what we've been doing so far, the plan had been just for me to cover that in our discussion tomorrow. But certainly if the goal is, if you would like more information, I'm happy to ask them to come and speak to that specifically tomorrow.
Okay, nope, that's fine. That's good. Thank you so much.
Okay, I don't see any other comments. Mark, thanks again. A rather lengthy discussion and crossed over into all of, as you started out saying, it's all intertwined. And,
Last thing, I did make one mistake. On page 5, I said 2 preliminary hearing attorneys. I just didn't highlight one preliminary hearing attorney. I meant to say the second one is the charging attorney to help the attorneys who charge these cases get these things through the system. Same basic argument, just I want to make that distinction. So thank you.
Okay, thanks again, Mark. Okay, next up.
Thank you, Commissioner.
Morning, Judge.
Good morning. Let me address a couple of the questions that have been asked, and then I'll get into what our specific request is. To Commissioner Cruz's question on what all these lines are on line 2 or page 2 of the ask. So what the courts basically need are two things. We need people, and then the support things that go along with the people, and then we need places to put the people. So if you look at line 14, which is the courts, that corresponds to page 11 in your packet. And so that $1.6 million figure, that's the first column on page 11. And Ellen did a really good job of breaking this down. The 2021 request, 2022, 2023, and then the total cost. But that 1.6 number comes from the total of the 2021 column. Lindsay can correct me if I'm wrong, but I think line let's see, line 20, that has to do with the remodel space. That's something different than what we prepared on page 11. That's something that's sort of, I mean, we've asked for space. They're the experts on what that costs, and I'll let them speak to that. On the question of Veterans Court and question of mental health court, two things. Number one, we've been in contact, or at least our current drug court judge, Judge Woods, has been in contact with Judge Winnell in Johnson County. Judge Winnell is setting up a mental health summit in October to explore the, what it would take to correctly set up mental health courts and the like. Judge Woods is going to that summit in October, and I'm not quite sure, Ellen, help me out, or Joni, who all else is going with him? We've got folks from the Sheriff's Department going with him, probably folks on the mental health side.
The new position that we're hiring to
Yeah.
see that will put together a group.
So we're sending a team to that mental health summit in October. So it's in my view, if we're going to set up a mental health court, it should be done with some study. We should get it correct, and so we are doing the preliminary due diligence to figure out with other judges across the state what it would take to set something like that up. On the subject of the Veterans Treatment Court, I was visiting with Commissioner Meitzner before the staff meeting. Senator Moran's office had reached out to me, 3 weeks ago, about the possibility of a request for funds at the federal level to set that up, and basically, on short notice, wanted to know what the Sedgwick County ask would be to set that up. So we very quickly reached out to Johnson County to figure out what it is, how much, in raw numbers, does their program cost. We estimated that our program would likely be, encompass a larger number of people since we have the larger judicial district. So we inflated that amount to a certain degree, and that's how we got to the $1 million request that Senator Moran's office has put in. That's a 3-year request, so that would be roughly, we're estimating $360,000 a year to get a Veterans Treatment Court up and running. That was based on Johnson County's numbers. It wasn't really based on anything. I just didn't have time to do a deep dive into what it would take. I figure Johnson County has done that. We'll figure out what their numbers are. We'll add a little bit to that, and that'll kind of get us in the ballpark. Maybe that number's high, maybe it's low, but I do think it's in the ballpark for a Veterans Treatment Court. It's my understanding that earmark, basically what Senator Moran's office was asking me is, do I have permission to ask for the earmark? And if it's approved, you don't have to spend the money if you don't want, but it's there. Well, I mean, if that's the case, I said, fine, go ahead and ask for it. And if it's there, that's a great resource available to us for the next 3 years to set it up. It's my understanding that money wouldn't be available until sometime next year, probably in the spring or summer of next year. So we have a little bit of time to visit with Johnson County, visit with some of the other stakeholders at the VA who would be providing this, visit with Glenda, to figure out what it would take to set up a Veterans Treatment Court. The concern that I have, and it's a concern that I have with some of these other requests that I'm going to get into, is that we are basically, the 18th Judicial District is basically being asked, at least in terms of the Veterans Court and the Mental Health Court, and some of these other positions that I'll get to when we get into the deep dive of our ask, but we're being asked to set up what I would consider to be permanent systems with temporary funds, and that worries me some. I mean, at some point in time, if we do get the earmark from the feds for the Veterans Treatment Court, you get to the end of the 3 years, and maybe they can ask for another earmark. Maybe it gets approved, maybe it doesn't. I don't know. I do know that Johnson County's program has run for, I think, about 5 years, funded heavily with grant money. So I assume that, there's going to be some grant money there available. But in terms of who runs that court, the judge, the support staff, the attorneys, these are all people that the community, and I think you all as well, would expect to be there permanently and not just leave if the funding runs out. So I'm happy to take any questions you may have at this point on either Veterans Court or Mental Health Court before I get into the weeds of our request.
Got a couple of questions.
Sure.
Commissioner Dennis?
Very quickly, is that $1 million over 3 years, does that include all of the different agencies or just the courts?
That's a good question. What I did was to reach out to Johnson County and say, what is it that it takes for your court to run? And I assumed that was staff people, what the agencies that were contributing. So I don't really have an answer to that. I just sort of used it as on short notice as a rough place to start to get me in the general ballpark if it was approved.
Very good. Well, thanks. We'll probably have to have our staff then do a little deeper dive into
Right.
it so that we can find out what impact it's going to have on Glenda and the sheriff and the DA.
Yeah.
But thank you, sir. Thank you, Judge. Appreciate it.
Commissioner Cruz?
Thank you. I guess the overall arching goal, like the vision for this, would be to shift a population from one court to a specialty court that's designed to put them in treatment programs to keep them out of the courts. So how can we figure out with Johnson County in this mental health summit, what is the thought process of really taking care of a person at the level that they need to be taken care of to keep them out? I mean, won't that save money?
Well, I think it would to a certain degree, and I think it would. It's obviously not the same thing as drug court, but I do think that the drug court model is kind of a useful tool to understand it. It's the same. People have varying severity levels of mental illness. I mean, some have severe mental illness. Some, it's just a matter of I can be functional in society if I just stay on my meds, but I don't like the way the meds, So, like anything else, some people will require heavier supervision than others. It's just a different agency that's supervising it instead of, drug counselors and drug treatment people. You're dealing with mental health folks, and so you're dealing with a different. Although there's some overlap with drug abuse issues and mental health issues, mainly with mental health courts, you're dealing with other providers. Similar to the Veterans Treatment Court, you would be dealing heavily with the VA and the resources that are available there. So these are things that I'm not really prepared to discuss in great detail just because I don't have this knowledge to share, but it's one of those things that we're hoping to be educated on at the Mental Health Summit in October.
So Glenda provided us with some numbers a while back. Drug court costs $24.35 a day. What is a normal docket cost? I guess I'd like to know that. So when we talk about prevention services, when we talk about, the jail costs $71 a day, adult residential is $62 a day, all these programs that we're already paying for, if we could have a court that costs us less to manage in the long run, I mean, we're talking a legacy here,
Sure.
right? I mean, that's really what we're talking about, to set up programs that when we're all gone are still in place that reduces the cost to the taxpayer. That's essentially what we're trying to do here. So I get it, it's going to be painful. It's going to
Right.
be painful, and it's going to be a lot of upfront work to do, but I know that we'll get there. It's just, I know that you haven't had time, but I'm looking forward to working with you on this.
Sure.
Because I think that there is something to this. If it creates less money to pay, less money to us to have to manage, and it creates a better outcome, I mean, it's a win-win.
Sure.
Thank you.
Well, and we'll keep you updated as we move forward on the Mental Health Summit and on Veterans Treatment Court. Okay, so then to turn to page 11, which sort of sets forth the district court's ARPA request. You'll recall when we had our ask earlier in the at the budget meeting. Oh, what was it, a month or two ago? I had visited with you all about the concept of pro tems to handle a preliminary hearing docket, and I kind of laid it out and explained it there. But that's basically, that plan has been rolled into the first line item on our positions and hours. That's that preliminary hearing position. Let me take two steps back though and talk about the backlog sort of from a 50,000 foot view. When the Supreme Court turned off jury trials in the spring of 2020 and asked us to submit a jury trial plan to reconstitute jury trials, which we did. We had 2 courtrooms that were allocated for jury courtrooms. Our strategy at the time was that we're not going to try to run a marathon without first learning to walk. So the jury trials that we did in the beginning were lower level jury trials. The very first one was the one I did, was a municipal court appeal. It was a 6-man jury, mainly to learn how these things are going to be done in a new environment. And our strategy was to learn on the easier cases first. Once we get good at that, we work our way up to the harder cases. All of which is to say that most of the jury trials that were conducted from August of 2020 through December of 2020 were all lower level felonies. They were out of custody felonies. So those jury trials really didn't do much to get at the backlog in the jail and get at the backlog of the higher end felonies. We really started doing, Ellen, correct me if I'm wrong, but we began higher level felony jury trials in around January of 2021. And so it's really only been about 6 months since we've got at the higher level felonies, just because it's harder to conduct those trials under the old COVID protocols with plastic in the courtroom and 6-foot distancing and everybody masked and things like that. So as a result, that's really what is driven and what's contributed to this backlog of felony 4 and ups waiting for trial, is just that we weren't prepared to give them that until January of this year. So the idea, as I mentioned at the previous budget meeting, we have 10 criminal judges in our criminal department. The idea is to take one of those functions, that the preliminary hearing function, which can and does create all kinds of scheduling problems for judges with jury trials. These are people that request this sort of a hearing. It's an evidentiary hearing where the DA is putting on witnesses and the defense attorney is cross-examining them. And it's just really hard to schedule jury trials around those hearings. And so if we take those hearings off the dockets of our 10 trial judges, we put them on the dockets of these pro tems, we now have 10 criminal judges that can run jury trials smoothly and quicker. Now, here again, that requires the DAs to staff those trials. It requires defense attorneys to be available to cover those trials. So skipping down, you'll see we have an ask for 10 defense attorney positions, roughly 25 defense attorney positions. They're broken out in the middle there, so that we have the people, all the necessary ingredients, all the players that you need to have in the arena to conduct a jury trial. And that, you add pro tems, then you're adding administrative assistants, and then you're adding computers, and you're adding equipment, and you're adding all this stuff. And so that really, the furniture, the equipment, the software, all that stuff flows from those positions. The other docket that has suffered directly from COVID has been our family law docket. The divorce filings have gone significantly up. Ellen's run the numbers on that. The shutdown over last year has not been good on domestic relations, and it has resulted in an increased filing of divorce cases that is threatening to overwhelm the 5 judges that we have in family law. And so we have asked for 2 FTEs, for 2 pro tems to try to get at that backlog. I don't know whether those positions, whether that trend in accelerated family law filings will continue, or whether that's just sort of a blip, related to this shutdown and people having to live with each other for a year, or whether that's a long-term trend. I just don't know. But I do know that there has been a spike in divorce filings. The other thing that you'll see in our packet is, and Ellen can maybe answer questions better than I, but 500 ADR sessions for family law cases. This is like an online, this is what? So these are facilitators that would come in and try to mediate some of these cases to, basically it's binding mediation, if I understand the concept correctly, where you're asking the parties to come in, all right, you can't live with each other, can you at least talk with each other to try to figure out how you're going to divide your assets, your debts, how you're going to chop up family time on parenting, can we come to some agreement on maintenance, on child support issues, and if the parties come together on all that, great. It's binding. That's what that ADR is. ADR stands for Alternative Dispute Resolution. The rest is fairly self-explanatory, so I'm happy to stand for any questions that you may have, or I can get deeper into the weeds if you'd like.
Okay. Thank you, Judge. Appreciate the first part of your conversation, too, to help clarify some of these questions that we all have. And then this was really good. Commissioner Cruz.
As a general question, and I don't know enough about how courts work to really know, so I'm just going to ask the question. Are there technologies that you have considered that will help run your court more efficiently?
Well, Ellen?
Yes, and one of those is the online dispute resolution.
Okay, so it's already in here. Okay. Just wondering. It's 2021. There's got to be something out there to make things work a little bit better. Thanks.
Well, and to that point, all the CARES money that we got last year, a lot of those funds were used to outfit most of the courts with upgraded audio visual, so that Zoom was not a thing that was considered in terms of court use and court hearings. Now every courtroom is set up for that kind of thing. So we took a giant step in that direction last year with the CARES funds.
Okay. Thank you, Judge. I don't see any other comments at this time.
Thank you.
So appreciate the presentation. Okay. Next up. Good morning, Sheriff Easter. While you're walking up, thanks again for your swift actions yesterday at that tragic event out there at Cheney Lake.
Well, thank you. As a team effort with everybody that was involved between fire, EMS, and law enforcement. So,
Yep.
and it's sounds like it's going to turn into a good ending. The child made it out of surgery and is recovering. So
Good.
It's a good thing.
And thank you for the update.
Well, thank you. I appreciate you giving me the time today. As you've heard from the DA and Judge Gehring, one of the plans to resolve the backlog involves preliminary hearings taking place 5 days a week with a pro tem judge in a courtroom. So the first ask for us is to be able to accommodate that. We would need 2 additional deputies. The reason for this is A lot of those prelims are folks that are currently in our custody. So a lot of those prelims are also very violent criminals. And right now, when we have a homicide trial, it can take up to 4 deputies to provide security in that courtroom, because we have to provide security to the defendant, we have to provide security to the families that are in there, we have to provide security to the jury, and then also to the judge. And so, I have to tell you some of the issues that have gone on in courtrooms across the United States, and we want to make sure we can hopefully prevent those from happening here. So even when we have individuals come that are not in our custody, that are out on bond, there's times after the prelim they're ordered back into custody. And so it will take 2 of our deputies to be there full time to be able to properly secure that area, and then also transport the prisoners over one at a time to keep the prelims going. So that's our first ask. One of the things that we're very, very happy about within the sheriff's office, last year we hired a health and wellness coordinator. I think you've heard me talk about this before, that after Deputy Coonsey passed away, and we suffered a lot of issues within the department. We've also suffered a lot of issues in the last year and a half within the detention facility, just because of the long hours, the burnout, and we've actually had to take some of our personnel to ComCare and to the hospital while they were working. So we've started the process of the health and wellness coordinator, which we now have 30 peer support specialists trained. We've done a sharing thing with the Nashville Police Department. Nashville used to be a department that had a large turnover. They switched chiefs. They had a deputy chief that became a chief who looked at the entire program to integrate it from rookie school until the time you retire. So it has to do with retention. It has to do with treating folks properly. It's not always about money. It's about how they feel valued as an employee with the Nashville Police Department. So we sent some folks out there to look at their program, and they're coming here in September to take a look at ours and how we can integrate more processes into that system. One of the things, they have a dedicated unit there. Granted, they don't have a jail, so we're just a little bit different because ours will be integrated with our detention staff and also our civilian staff. But it's from the time of hiring, attaching mentors to brand new law enforcement or detention deputies, talking about resilience, talking about how to deal with issues at home. Whether it's family, marriage, financial, and then the issues that are related to law enforcement work. And so their unit consists of, we've talked about, we're looking right now at a retention specialist. They don't call it a retention specialist, but someone who coordinates the mentor program, and they coordinate a lot of other programs Nashville has put into place to retain people. Nashville now is the top-ranked department that has the least amount of people that leave. They have the highest retention rate of any other police department, and they're about a department of 1,800. We interviewed several of their employees, and all of them to a T said, hey, I came from another department because of how they treat their people here. We're valued, we're appreciated, they take care of us, they know that when we have issues, we got people to go to. We have a system that we can rely upon. They also use the Cortico system out there, or website to also help. So they have a unit that comprises of all these folks plus a crisis counselor. And so what we wanted to look at is adding a crisis counselor to this unit, which would be our health and wellness coordinator, our retention specialist, once we work out the details of exactly what that looks like by using a model from Nashville, and then a crisis counselor. One of the things that law enforcement traditionally has never been the type of folks to go and reach out for help. And that's why we have issues in law enforcement with suicide rates, divorce rates, and alcoholism. And so cops are they just don't want to go to anybody and expose their problems and those type of things. And so it's very important that we have a culturally competent person, and then somebody that's inside the department, understands the sheriff's office, understands what we go through, and that can be trusted. Impact, we've seen a huge increase in impact and sheriff's offices sheriff's office personnel utilizing impact, which they weren't before. And that comes from the mental health or the health and wellness coordinator, because of all the hard work that she's done to build these programs, to build the trust, and to say it's okay. It's okay to express that you're upset seeing a 2-year-old shot, those type of things. And so we think that would be a hugely important piece to our health and wellness program. Next, we have a warrant clerk position. And I've talked about this before. It was something that we looked at to propose to you all I originally discussed it in our budget hearings. So one of the things that we have right now is our extractor has been broken between the district court and us, and so all the warrants have to be entered by hand, which has caused. Last summer we went out and got a part-time employee to assist us with that. We've also used overtime, a lot of overtime, to help pay for that. And with the backlog of cases being charged, a good majority of them will actually turn into warrants. And so, as you can see, we process about 10,000 warrants per year. That's hand keying in 10,000 warrants. Once we get the Odyssey system online, which I think they're talking February of June of 2022. And then our RMS system, it will start reading the information, where it will cause us to have a lot less hand entry into the systems. And so this warrant clerk position would resolve some of those issues that we're having right now until those systems get up and running and then actually start talking to each other. Next, we have a court security camera system. Our security camera system is very old up in court security, which means that in the cells where prisoners are housed before they go into court, it doesn't record. It works most of the time, those type of things. We have gone to Axon and everything else that we do, which is cloud-based storage, those type of things, which is a much better system. And so we're asking for that court security camera system to be replaced through ARPA money. That's also in our budget proposal for you all right now, but we would replace our budget proposal with ARPA money. Court movement coordinator, so what we have is a detention deputy every morning and then all day long until 5 o'clock that does nothing but coordinates getting inmates out of their pods or their cells down to our holding cells until deputies over in judicial can come over and get them and then take them up to court and then bring them back down. So it's kind of a lengthy process, and we always want to make sure that we're on time for the judges, because the judges are busy and they don't need to be waiting on us. And so that is a full-time position. We believe that a civilian employee could do that particular job at a lesser rate, but it also frees up a detention deputy to be able to work in detention, since we are short, instead of this function. The next thing you've heard me talk about, due to our shortage of personnel, we have switched over 4 dorms. Those are some of our lower classified inmates. I will tell you too, working in the facility, got a lot of suggestions from some of the inmates that are 50 and older, that they want to have their own pod because they don't want to be around the mess that some of the younger ones bring in. And so one of the dorms has turned into a 50 and older pod, which is full, and we have 0 issues in that pod. And so 4 of those pods are no longer being manned by a female or male deputy. Those are strictly being looked at over the camera systems. Every hour we go in and do our checks like we're supposed to do, but we do not have somebody in that pod 24 hours a day. So far it's working out. However, there needs to be additional cameras in there because the cameras that we do have, there's areas there that we can't see. There's areas there that inmates could either be sexually assaulting somebody or assaulting somebody that we wouldn't be able to necessarily see right away. So that's a one-time cost as well. And then video phones for a professional visit. We currently have 5 that are being utilized by the conflicts office and the public defender's office. Instead of them coming over to the jail, there was lines ran strictly to their offices, and then it's a video conferencing. So instead of being face-to-face inside pro visit, it's over the phone on a video camera. So we're going to add one more of those just because of the backlog and the possibility of more attorneys needing more access. So with that, of our ask, about $177,000 of that ask is a one-time cost. But all of this, we believe, will help facilitate what Judge Gehring and DA Bennett are trying to accomplish to work down the backlog.
Okay. Thank you, Sheriff. Commissioner Cruz.
Thank you, Chairman. Thank you, Sheriff, for being here today. So like we are discussing different specialty courts, we currently have a mental health pod, right? Is that full?
Oh, yes. Yeah, it is every day.
Is there, like you did with the 50 and over pod, is there a need for an expansion of that? Or is there any sort of other things that could manage a population better?
Well, I don't think there needs to be an expansion. What needs to be expanded, and that's what we're looking at in our medical contract, is expanding a mental health nurse. That mental health nurse currently shares duties with Glenda's group, and I think Glenda's working on a separate contract so that our person would be only with us. So I don't think we need a expansion. The issue that we see, it works very well. We're able to really step down people to the point where they can plausibly return to general population. The problem is when they return to general population, we see them go back up again. And it's because, they get bullied, they get picked on, assaulted, stuff stolen from them. A lot of times they quit taking their medication because they're not in the mental health pod where they're receiving nonstop therapy, nonstop people talking to them and reminding them to take their medication, those type of things. Now, we do have some folks that are in there that absolutely refuse to take their medication. And if they're a harm to themselves or others, then the only way we can resolve that is going to the judge and getting a court order to allow us to force medicate. It doesn't happen too often, but it can happen. And so from that standpoint, I think we're all right. An additional mental health nurse, yes, that would be a huge benefit.
How are you handling substance abuse? And that's probably a huge question that we can ask later, but I think when 70% of the folks that are in there have a substance abuse issue or have a substance misuse disorder, excuse me.
Yeah, it's a balancing act because when those folks come in and they start going through DTs, we got to house them up in the clinic. The clinic can only house so many people because they have to be monitored 24 hours a day because they can die going through DTs. Once we get them through that process, then they can return to general population and they start drying out. And so we do have some success there. We don't have, COVID really hurt us on our programs, our Narcotics Anonymous and those type of programs, AA, because the volunteers, well, they weren't going to come in because of COVID. So we're starting to restart some of those programs, plus some of our other programs, the mentoring program, those type of things that involves outside volunteers. And so, in the jail, they dry out, and then we try to keep them that way. And we've had issues there. I mean, people mailing in substances on paper that they can smoke. We just found out about another one that is not really detectable at this point. But we resolve that by any outcoming mail, unless it's attorney-client privilege mail from lawyers. It all gets scanned. They don't get the real mail anymore.
Yeah, I don't envy your job.
Yeah.
You have a tough
So.
one. But I do appreciate your willingness to consider other programs. We have talked
Yeah.
briefly about an arts program that we might be able to at least explore. I think that it really shows to,
Anything to get them to quit painting on the walls would be a
Right.
good thing.
yeah, so I appreciate that. Thanks for being here and sharing this with us.
Thank you.
Thank you, Sheriff. Okay, I don't see any other questions.
Okay. Thank you.
Thank you. Okay, next up.
Good morning, Commissioners. Glenda Martins, Director of Department of Corrections. So you've heard from the DA, the courts, and the sheriff. So you understand there's a backlog. And how what my request is going to talk to the first request. I have 3 requests. And the first one is due to the DA having this backlog of cases ready to be filed and move forward through the court. As those get processed, that means in corrections that my staff will be inundated with intakes. And so my request is for 1 FTE for an ISO. This would be a one-time cost, one year, to get caught up on those intakes at a cost of $62,486. The second request is for, we would like to take one of the squad rooms at Adult Res and Work Release and turn it into a isolation quarantine dorm for the females. Currently, we have 2 dorms right now. They house 12 and 12. But when we bring our female clients in, it really, we don't have a separate area to quarantine and isolate them. And so we would like to turn the squad room into an additional dorm. So that would add additional beds for females. But during COVID, obviously, it would allow us to quarantine them without disrupting all the females in the other 2 areas. And so we've looked at this in the past. It was expensive to make this change. But we feel like with this ARPA money that we could do this. And so the total cost to change, to switch out that area would be about $173,790. And that's approximate from a bid that we'd had earlier last year. That would also include two corrections staff to assist with the supervision of that dorm. And it includes meal cost for the clients. Okay. We do get revenue for those beds, and so potentially this could pay for itself after we get completed. Because the revenue, if those beds are full, are about $193,000. The last is a new drug diversion program. So this was a new bill that was signed into law July 1. Mark Bennett and I have been working on a MOU to implement this new drug diversion program. We guesstimate about 100 to 200 clients. I currently had been preparing for this, so I have an ISO position that I will obtain at January 1st, but we would like to implement this sooner, and so what my ask is for is to bridge the position sooner, to start maybe in August to December, and then also add an additional, because it would probably take 2 ISOs based on the numbers. What else is included in this cost is that Senate Bill 2026 did not put in funding for this. They the legislature has to go back and really determine the funding for this. They suspected that there weren't going to be that many cases, so they were going to use carryover funds from Senate Bill 123. Looking at our numbers and what the cost is for treatment, I suspect we will use all the funding that Senate Bill 123 has set aside just for Sedgwick County. And so that's why I have supplemented money to take care of treatment, the assessments, the drug and alcohol, so that we can get started on this really quickly and not be in the middle of it and have funding run out for clients. So that total cost is $428,922. And we suspect that they will then next year obviously put some funding attached to that bill. So I heard a lot of discussion about mental health court, veterans court. So I kind of want to give you what it costs to run drug court. And so right now I have 5 FTEs for running my drug court. That cost is $623,707 to manage that. ComCare also has staff that work in drug court as well, and that cost is $165,199. So there is a cost to managing, a specialty court, and how it gets managed, whether it's community corrections staff or whether it's court services. It takes people to do that. And as you know, the thing that I'm struggling with right now is staffing, the hiring of employees. So these are all things we have to consider when we decide we're going to do a new program, and how fast we can get it up and running. I can tell you that I have had an application in one of my other programs for a BIP position, a batterers intervention program person, and that vacancy has been out there for 2 years. So it's a struggle, and we can certainly have the ARPA funding available, but I also have to have people that can apply and work those programs. Okay, any questions?
Well, a struggle on many fronts for replacing people and keeping them retained and replaced. So thank you for your presentation, Commissioner Cruz.
Thank you, Chairman. Thank you, Glenda. I know that you're always looking for ways to improve. I am looking forward to seeing the outcomes of this new drug diversion program. I guess the one thing that I just really want to reiterate is that when we have specialty courts, it's not like we're going to have a whole new population of people that are only going to be there. We're going to be shifting the population of people who are already in the court system to that. So it's not like we're going to have double. I mean, we could see more people, but I just really want to be clear, and correct me if I'm wrong, because clearly
No, you're right. There's going to still be a court. There's still going to be supervision. Running a specialty court is very intense work for everyone, the judges, the courts, the staff that manage it. The outcomes are great when they happen, and so it's certainly worthwhile doing, but just understand these are intense courts. So they're very time consuming, and they're costly, and so it's great if we want to get one going and use, like Judge Gehring said, money to get it started, but in the back end, when the money is gone, then how are we going to support it? We need the county commissioners to all be in favor of moving that forward, because there is no other grant funds that I have access to that would make that happen.
Sure, and And I'm well aware of that. I think we all know where I sit on this
Okay.
issue. I just want to make sure that we understand that the hope is to shift a population to a more intensive service that will keep them from coming back into the system.
Correct.
That's-
And from going into prison, that's where the big cost savings ends up being, is that they get the treatment they need and they don't go further into the system and they don't end up in prison where the cost sits as well for the state. So, yes, specialty courts are a great thing. Getting them up and running is
painful.
Is
It's gonna
painful.
be painful.
Is
but I
painful.
think that we're going to get there, and we have to start because we see what we're doing currently. We're maintaining a system that's been there for a long time.
Sure.
So what could we do to reduce the number of people going through the system? Will this be a measurable outcome that we can see? And I think we can because we already see it in our drug
Sure.
court program. So
Absolutely.
thank you for bringing this today. Appreciate it.
Sure.
Commissioner Dennis?
Thank you, Mr. Chair. Well, Glenda, your numbers show about $800,000 between you and ComCare to operate the drug court. Do you anticipate another $800,000 to operate a veterans court, another $800,000 to operate a mental health court, or
I would love to answer that question without diving a little bit deeper into a veterans court and what it would take and how many people, because we really go back to starting out with what do the numbers look like? How many staff am I going to need? How much time is the court going to need? If it can be modeled very similar to the drug court model, then yeah, it would probably be about the same. And we would have to have maybe more mental health people for a mental health court. Maybe the same for a veterans court. It just really depends on the numbers.
Very good. Well, I look forward to a little deeper dive in this from our staff and everyone involved. Thank you.
Thank you.
Thanks, Glenda. Appreciate it. I don't see any other comments. Okay, next up, I know we've got some timing going on.
Number, Commissioner Dennis, when we did our due diligence with Johnson County Veterans Treatment Court, they have 40 participants in that program. We probably would have a little bit more than 40, but I anticipate it would be less than the number of people participating in drug court. I also neglected to mention in my remarks that OJA has approved a permanent position just below Ellen in the org chart to manage court criminal programs. So we are at least getting some help from the state to manage some of these things that we're asking you to approve today.
Okay. All right. Next up. Good morning, Doctor.
Good morning, Shelley Steadman, Director of the Regional Forensic Science Center. Last but not least, but it is the least because I think my amount of money is the smallest.
And Shelley, before you start, so we do not have a hard copy of this one, correct?
Yeah, there's.
Okay.
It's pretty simple.
Okay, all right.
So I'm here just to give a brief overview about what the Forensic Science Center does and our contributions to prosecution of court cases. Fair to say most criminal cases, especially if they are violent in nature or felony level cases, are impacted somehow by the Regional Forensic Science Center. Ironically, even when they're not, the jury expects to hear some sort of forensic testimony because they watch a lot of TV. But it's also fair to say that there are a good number of cases that don't have to go to trial, and that's due to plea agreements. And very oftentimes, that's because there is an expert report or an opinion that exists that makes the jury decision in favor of the defendant very tentative, and so that person decides it's in their better interest to enter into a plea agreement. And so I think aside from how we participate with our expert witness testimony, we also participate to resolve cases that don't have to go through the expense and time and effort and resources for a trial. I'm here to talk about a very specific use of these funds that has been defined, and not saying I won't be back next year to talk about other needs we have, but this is directly related to the directive that this money can be used to address gun violence in cities because that violence has been directly traced to the impact of the pandemic. And our firearms lab is equipped to conduct the analysis that's necessary to solve those crimes and prosecute those cases, except we need trained examiners to carry out that analysis. That said, what they do is they determine which guns were connected to which crime scenes. And to that end, seized weapons now are, for the most part, test-fired and entered into a national database. And when that database generates hits, it takes a human being to confirm those positive associations, say between a weapon that's seized and a cartridge casing that was at a drive-by shooting. The markings that those weapons leave on ammunition is very specific and signature to that gun. So if one of you and I went to Gander Mountain today and we each bought a Smith & Wesson 380 handgun and we fired it into the water tank at the Forensic Science Center, it would be a qualified examiner who could take the components that popped out the back of the gun and retrieve the bullet from the water, and they would be able to tell us which of the two guns each of those components originated from. Not surprisingly, that type of training is very long. It's an apprenticeship-style training that usually takes approximately 2 years, and you need a qualified examiner to provide training to a trainee. As you probably know, a couple years ago, we lost our only qualified fire examiner, which left us dead in the water, so to speak. We had extra challenges with the pandemic and not being able to travel places to receive training, and so we were fairly inventive, and we found a highly reputable training academy, the Nichols Academy, and we got our more senior examiner into that academy. She's currently trained to do test fires, and we've since hired a second examiner. She is completing her academy and now training that second examiner for function testing as well. What most of this funding for the Forensic Science Center would consist of is the opportunity for that second examiner to also go through the Nichols Training Academy. It's a series of 3 modules or 4 units of training, and the cost is $32,250. This would allow for, they could very well be overlapping. One could be completing the training while the other is starting it. And then when our first examiner is done with the training, she'd be able to start doing casework. I think which is important to the district attorney's office because we are currently in line with all the 103 other counties to get our firearms examined at the state laboratory. And as you know, every other jurisdiction, more so than Sedgwick County, has problems with getting these cases through their courts. Another aspect of training that I'm requesting is part of a standard training program, and it involves firearms examiners being able to receive training at weapon manufacturers. Because the irregularity of the tools and the processes that are used to produce gun barrels are the very source of the lands and grooves and the markings that are on ammunition when it is expelled from the firearm, that allows the examiners to do their comparisons and make their conclusions. And understanding that process quite simply just expands the competence of the examiner and increases their ability to link or exclude guns to and from crime scenes. What that means is those reports go out faster. The district attorney has information on linking those guns to the scenes, and those cases get to court more quickly than they would if the reports were pending. So we have a unique opportunity where our examiners would be able to travel to the East Coast, where there's a greater density of manufacturers, and be taught at a number of those places over the course of a week or so. I think it's a very unique opportunity. One of them, in fact, was on a waiting list 80 people deep. And so we feel lucky that we would be able to let both of these individuals have shared costs of transportation and hotel and be able to provide them with that training at this time. And there's about $10,000 built in for that, but we're currently, literally today we're scheduling the airfare, and I think it'll probably be less than that. But we've all heard about how rental cars are, and airfares are rising in cost, so I didn't want to fall short there. With that said, and on behalf of the firearms unit and everyone else at the Forensic Science Center, I'd be happy to answer any questions that you have.
Okay, Shelley, I don't see any questions. Thank you for presenting and last-minute addition.
Thank you.
very much. Okay, Lindsay.
All right, Commissioners, so the final piece of our public safety deep dive this morning is going to talk about how are we going to manage the space for all of this. So one of the themes that has come out of this conversation clearly is an increased need for staff, for court space, especially now this morning hearing about specialty courts. And so the conclusion that we came to was that in order to accommodate the sheriff being able to safely transport inmates, in order for the courts to have the security that they need, what we would look to do is remove all of the county administrative functions from this building. So that would include you all, the county manager's office, the county counselor, the register of deeds, the clerk, whatever remains of the treasurer's office, as well as finance on 8 and 11. We would move into short-term leased space. We have consulted with Whit O'Brien's, who of course is kind of our eligibility guru. They have said for probably a period of about a year, it would be acceptable to use ARPA to pay for that leased space for administrative functions. Well, obviously, from what you've heard this morning, this isn't going to be solved in a year. And so the goal would be then to construct a county administrative building using our debt financing, because we do have plenty of capacity, and I'll have that information for you tomorrow on what that would look like, so that we can permanently turn this space over to the courts. Now, just because we're out doesn't automatically mean that my office on 8 makes a nice courtroom. So we obviously will have remodel costs in this building. That is another estimate that you'll see on your sheet of around $7 million. That's another thing that Whit O'Brien's had advised is an eligible cost under ARPA, is to remodel the vacated administrative space into court usable space. So when we had talked about an administrative before, a building before, and all of those components that come after, the cost was overwhelming. When you take that component out, when that becomes something that ARPA can pay for, that becomes something that we definitely want to look into as a way to do this. Now, the problem, of course, becomes this is a fairly urgent need. The courts are looking to address this quickly. This is a 2021 spending plan. And so we would look to begin that discussion with commissioners in more earnestness after we have a spending plan that you have signed off on. Now, let's talk about a spending plan. It's just like a budget. It's a plan. We've talked about it before. It doesn't mean that it's a goal to spend every penny, right? But we need estimates, and we need to make sure that there's authority there. So again, with the rules under ARPA, we know that procurement is going to look a lot different than it did for CARES. We had a lot of flexibility to waive finance, HR, and IT policy because of the health order. Because ARPA goes through 2024, we don't have that same kind of flexibility. So we will go through competitive processes, RFPs, RFBs. We will go through our normal process of evaluation committees and bid board and commission sign off. So this is just a first piece. Now, some of this stuff is easier. Contract attorneys, because we already have rates. Staffing, because we can prove how clearly eligible it is. Some of this stuff we're able to move more quickly. Other things will take more time and more process. But this is obviously a very important component of making this all work and making it happen quickly. So I have obviously Tanya here if we have specific questions about the costs themselves. This was done very quickly. Obviously, we just started having the discussion 3 weeks ago, so there's still some refinement. So we don't want to hold her to anything too specific here, but just wanted to get this conversation started with you. So that is it for our public safety deep dive. We will pick up this discussion tomorrow. Commissioner Lopez, I apologize, I didn't have the information with me, so I'll have it for you tomorrow. And we'll go through this a little bit more, but not quite in as much depth at your meeting. And hopefully get a vote so we can start making some of this happen.
Okay. Don't see any comments right now. In summary, I want to commend Tom, you, and management, and for gathering these public safety managers at all and to see them all, it's clearly evident that they're all working together. I don't see any silos. I don't see anybody disparaging any, thinking theirs is the most important. It's just really comforting to see teamwork in this incredibly important area of public safety. I witnessed it a little bit a couple years ago when the ICT-1 thing was getting silos together, and that proved to work. But this is incredibly more money and more departments. And my compliments to each of you as managers of your selected area to work together to come and do this. It's rewarding to witness. So I don't see any other comments related to this staff meeting, unless there is any. So we will. You have anything else, Tom? Okay. So we will stand adjourned. Thank you. See you tomorrow.